Okay, everybody, welcome to Reopen Connecticut Arts Venues through Science-Based Safety. I'm Eric Dillner, the CEO of the Shoreline Arts Alliance and the chair of this task force. Our goal today is to offer clarity, practical scientific advice, and an opportunity to ask questions related to your own risk reduction strategies in the workplace or in your artistic spaces. Obviously, to provide a listening and sharing platform and to help you build consumer confidence through science. We, of course, want you to share this with all your colleagues broadly. We want to thank some folks really quickly. The Emily Hall Tremaine Foundation, Connecticut Office of the Arts, Connecticut Community Foundation of Greater New Haven, Connecticut Humanities, and Community Foundation of Middlesex County for all stepping up as partners along with our, of course, cherished partner, Yale School of Public Health, Crystal and Sten, and their big team. You guys, all of your gifts have helped guide the arts community at large through the toughest of times. And I'm sorry to say we're not done, but we hope we're getting there soon. We encourage you to attend as many of these webinars as you're able to, and don't forget to find them playing constantly on our Facebook, as well as we'll put them over on YouTube so you can find them there. Our website is fully accessible, and you can turn on and off your closed caption buttoning for today's webinar. So let me just quickly introduce, most of you all know, Sten, the Dean of Yale, Sten Vermund, the Dean of Yale School of Public Health. He holds an M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. We're so honored to have him be a major partner with us, and we have Crystal Paulette with us today. Crystal is an assistant professor in the Department of Environmental Health Sciences of Yale School of Public Health, and she holds an appointment in the School of Engineering and Applied Science. And thankfully for us, her specialty is indoor spaces. Thank you both so much again for staying along in this journey with us, for being so attentive to our goals and needs of the arts community, and just for making our lives so much better for being a part of us today. Today, we're going to cover an awful lot of things. Sten, you can share your screen whenever you're ready. You can get it going. Sten is going to actually present to you a slideshow with some really great information that he's developed for us. So much what he's going to share with us today goes beyond the arts and goes into your families and into your homes and into your communities. So I hope you'll take a lot of this your way. Now, don't forget, we want to offer you an opportunity to ask questions. Several have already flooded in today, and we'll probably reserve most of those questions for the end of the chat here, but in about 20, 30 minutes or so, we'll definitely be answering a bunch of those questions. So use the Q&A if you can for that, and here we go. So Sten, once again, my apologies for the link mix up there. I'm so glad you're in with us today. And why don't you take it from here, Sten?
Thanks, Eric. Can you hear me okay?
You sound great.
And the slides?
And the slides look great as well. Thank you.
Time to rock and roll.
Here we go.
Let's talk, reminding you that we've been through pandemics before. The 1918-1919 influenza pandemic near the end of World War I was quite devastating. Here are officers in Seattle who looked like police persons, but they were actually healthcare workers with some police authority, and the closed theater that looks familiar to us. We've had over 800,000 deaths in the United States as of a few days ago, and CDC estimated nearly 700,000 deaths back in 1918-1919. So when you control for population differences, we've achieved almost half of what that world-shattering event was in 1918-1919, just to give you a little bit of perspective. As of earlier this month, you see the death rates from COVID-19. This is just a screenshot from CDC. And in September, unvaccinated persons had, just for the month of September, had 6 times the risk of testing positive for COVID and 14 times the risk of dying of COVID. And when you look at deaths, you see this blue line with very low, sorry, I didn't mean to change there, with very low rates of death, and then the spike of death in the unvaccinated. So severe disease has now largely been become a disease of the unvaccinated or of persons with very serious underlying medical conditions. And this is true in Canada, it's true in Chile. I could have used 10 other countries as examples. Here are the death rates in Canada, the numbers of deaths of Canada of the unvaccinated versus the partially or fully vaccinated. And the Canadians have seen 80% less likely to be hospitalized, 68% less likely to die in their databases. Yeah, a major study from Chile published in the prestigious New England Journal of Medicine found that you were 66% less likely to be getting symptomatic COVID if you were fully vaccinated. You were 86% less likely to die if you were vaccinated. So, I mean, how much more dramatic do we want to get in terms of the benefits of vaccine? This is one of the safest and most effective vaccines that has ever been developed in the history of vaccinology. I did a talk for the University of Louisville earlier, I guess it was in November, and this struck me. We've done one of these webinars for the arts organizations in Kentucky as well. And if you just look at people who die of COVID under the age of 60, okay, so the lower risk demographic, 444 people had died between July and October in the state of Kentucky in this age group, and more than 95% of them were unvaccinated. More than 95, only 21 of 444. So you can look at the data nationwide, you can look at it at the micro level in the state, you can look at it in foreign countries, you're going to find the same thing, that vaccination is hugely protective against death and serious disease as measured by intensive care unit admission or hospitalization. Now let's go to the arts. I should have picked a photograph from a Connecticut arts venue, but this is the Metropolitan Opera House. Kind of more dramatic because it's so big. And we've got issues of crowding, we've got issues of mixing, we've got issues of oversight of our staff, our performers, our patrons, adherence to guidelines, and the need for education. All of these sort of key words apply to what our challenges are in the arts arena. So what's new? Mask and vaccine effectiveness in real world conditions is highly favorable. Efficacy is high, but to be effective in real world conditions, you also need the coverage. You need everybody to participate. So it may be effective in theory, but everybody's wearing their mask below their nose or refusing masks or whatever. It reduces the real world effectiveness of the intervention. Surface cleansing is helpful. We didn't think it was doing a whole lot for the ancestral alpha variant, but now that we have more infectious variants, maybe it's going to be even more important. Physical distancing turned out not to be quite as critical for prevention of alpha, but with Delta and Omicron being more infectious, it probably is coming back on our radar scope as something worth considering. And you've all heard about the variants of concern, Delta and Omicron. So what does the crystal ball say about all of this for public spaces? Risk for the aged, risk for the unvaccinated. We'll get into this in a moment. So these are funny little scientific tables. It says what are the variants that are dominating in our state? So upstairs is Connecticut and downstairs is the country of South Africa. So if you look at April of 2021, we had mostly alpha variant, and something called iota, which was a relative of alpha. But then by summer, delta became overwhelmingly the commonly circulating variant. So it shows you how much a competitive advantage delta variant had over alpha variant or iota variant. And delta has then become the dominant circulating strain in the state of Connecticut. Take a look at what happened in South Africa from the alpha strain to the delta strain, and how quickly that transition occurred from alpha to delta, alpha being sort of the rose colored, delta being the light blue. And take a look at Omicron. In a matter of weeks, Omicron has now become almost the exclusive circulating variant in the country of South Africa. And we're seeing the same thing happen in New York City. So New York City is making a very quick shift from Delta to Omicron. So guess what's going to happen in Connecticut in the next few weeks, probably the next week or two. So you're going to see Omicron be the dominant circulating strain in our state too. And we're already seeing it. These are data from Crystal, and I have a colleague, Nate Grubaugh, who does this work for CDC and for the state in our school. And it doesn't look too impressive in terms of the actual cases of people in the hospital, but the proportion of cases in the reports, it's now almost 10% as of earlier this month. And this is the mathematical model projecting what's going to happen. And probably by the end of the holidays, Omicron is going to be the dominant circulating strain in our state. So what is Omicron? Well, we know that it's likely to spread easier than the original COVID-19 virus because it's become dominant so quickly in places like South Africa first, and now New York City, and soon Connecticut. We do think that the current vaccines are going to work well against Omicron. That's our evidence. However, we would like everybody to be boosted as soon as you possibly can be, because the avidity, which is like the lock and key of the vaccine-induced antibody to the circulating virus, is not quite as good a fit. It's like that key into your house that was the copy of a copy of a copy, and you've got to jiggle it before you can open your house. That's kind of Omicron. And what you have to do now is overcome that by a higher antibody level. So a higher antibody level helps overcome the avidity imbalance, the lower avidity. So go and get your boosters as soon as you can. Advocate your patrons of your museum or your arts venue to do the same, your staff to do the same. And, 3 months ago, people were asking me about booster. I said, yeah, you should get a booster, but it's no big hurry. Well, guess what? Now it's a big hurry. And we know that some of the treatments seem to work well for Omicron, some of the drugs, but some of the antibodies don't work as well. So you'll be seeing new developments there. And there's a lot that we don't know. And this is just a little timetable showing how quickly, from South Africa, we knew that it was circulating on the 24th of November. The first case in the US was the 1st of December. So, we can travel within 48 hours and visit 95% of humanity. That's how efficient global travel is. Yeah, it'll take us more than 2 days to get to the to the mountains of the Himalayas where you have to go on a horse for 2 days just to get to somebody's remote village. So 5% of people we can't get to in 2 days, but 95% of humanity, you and I could go get on a plane and visit somebody 95% and get there within 2 days. That's how quickly you can get around these days. That's why these things spread. So they're remarkably effective. Take the HEROES study of 4,000 healthcare and essential workers. They found 161 infections in the unvaccinated workers, only 3 in the fully vaccinated workers, a 57-to-1 ratio. Overall, CDC recommends estimates an 11-to-1 ratio, but it's probably higher than that in terms of the number of unvaccinated to vaccinated. Serious breakthrough infections are extremely rare. We've had about 6 now. It's close to 500 million doses, but the boosters are lagging. And take a look at these death rates. 0.001%, less than that is the death rate. It's just, we had a death at Yale New Haven Hospital of an unvaccinated person about 6-7 weeks ago. It was a 93-year-old who had substantial underlying medical conditions, including one that resulted in immunosuppression. That was the person who died who was vaccinated. So vaccines are not going to save everybody if people are profoundly immunosuppressed and have profound alternative illnesses. But the rest of us, me, for instance, 67 years old, deteriorating immune system because of my age, I feel very confident and safe. I don't think I'm going to die of COVID, and I don't think I'm going to end up in the hospital if I'm infected because I'm boosted. And vaccinated individuals are less likely to pass the virus on to unvaccinated individuals, although Delta and Omicron are a bit more transmissible. And keep in mind that the vaccines are protecting against all variants, but we need the boosters. Why vaccinate kids and adolescents? They don't get sick. There's a member of my own faculty who goes on Fox News once a week and says kids don't die of COVID. Well, he happens to be wrong. And through the end of November, there were over 700 children who have died of COVID in the United States. And the immune system, the multifactorial immune system disease and the long, that's not what it's called, but I forgot the acronym, and the long COVID are vaccine preventable complications. And so this multi-system immune complication and long COVID do occur in children. You have missed days of school. You have isolation and quarantine that are disruptive. You have risk to vulnerable children and adults. So we want to achieve herd immunity in the face of vaccine hesitancy, since 10-12% of Connecticut residents are refusing vaccine, and it's closer to 20% in the United States. It's close to 50% in Idaho and Wyoming. We need the kids to be vaccinated to protect the adults who are not being protected. And we need to prepare for future highly infectious variants like Omicron is a good case study. Or possibly more pathogenic variants in the future. Omicron doesn't seem to be as serious. It doesn't seem to be as pathogenic. You're less likely to be hospitalized with Omicron than with Delta or Alpha. So it's more infectious, but it's less serious. So what if you have something that's not as infectious, but is more serious? SARS and MERS are examples of coronavirus that are less infectious, but more serious. So we want to have maximum protection from the vaccines, because we expect some cross-reacting immunity. If you're vaccinated against the Alpha strain, you're going to get some protection from Delta and some from Omicron and some from maybe a future vaccine. Plus, the vaccine manufacturers can give us boosters against Omicron or against, Omega someday. Now, none of this is new, this vaccine hesitancy that I alluded to a moment ago. This is a cartoon from 1930, where there was a smallpox outbreak in New York City, And these gentlemen are marching over the cliff of misinformation. Here's the anti-vaccinationist blinded by prejudice. Here's the fattest. Here's Mr. Careless. And this gentleman is anti-everything. Every one of these books is trying to convince parents not to vaccinate their children. And every one of these books was published before COVID-19. And it includes celebrity doctors like Andrew Wakefield and Robert Mendelsohn, celebrities in Hollywood like Jenny McCarthy, and celebrity public figures like Robert F. Kennedy Jr. All of them are anti-vax activists. All of them have published books. All of them make a lot of money from their anti-vax speaking engagements and all the rest. So that was the environment in which we then went into COVID. We already had a vibrant anti-vaccine movement. So the Kaiser Family Foundation has a very educational series of surveys that they do every 6 weeks or so. And they ask a question like, if coronavirus vaccines are determined to be safe by scientists and is available for free to everyone who wanted it, would you definitely get it or probably get it? Or would you definitely not get it or probably not get it or definitely not get it? And here's good news, that a heck of a lot of people have gotten vaccinated in this survey. Oh, I didn't mean to do that. I keep pressing the wrong button. And that's been a gradual success story. Like I said, we're lagging with boosters, but basic vaccination, we've done well. So these people have already gotten it. But take a look at the definitely not group, or the only if required group. It's kind of hovering in this 20% range all the way back since December 2020. So since December 2020, we've had this hardcore pool of anti-COVID vaccination folks who are doing everything they can to avoid getting vaccinated. And that is a problem for our nation. It's even worse when you ask parents about their teenagers or their kids, where it's an even higher number in the sort of 30 to 40 range of parents who are saying that they definitely won't, or only if absolutely mandated, which is kind of turning things on its head. Usually, parents care more about the health of their children than they do about their own health. So they're more likely to get their kids vaccinated and cared for at the doctor than they are to get themselves vaccinated or cared for at the doctor. But somehow the narrative has become so toxic that parents are scared on behalf of their kids. So they say, I'll take the risk for myself, this horrible risk of this vaccine. Oh my God, but I'm not going to have expose my child to this terrible thing. What the toxic narrative is that this is a terrible thing. This is one of the safest vaccines ever developed in the history of humankind. It's one of the most effective, and it's a lifesaver. That's the true narrative, but people don't get it. Now, it's become partisan. Now, I will say public health has always been political. If I want a new sewage treatment plant in my community, and I go to the alder persons of the town or the city council, and I say, we need another, we need a bond for $40 million sewage treatment plant because the one that we have isn't working properly and can't be remediated. We need a new one. Well, some people will vote for that and some people will vote against it. But for public health measures, we've always had a mix of Republicans and Democrats on both sides. It isn't necessarily, it's political, but it's not partisan. Somehow this thing has become partisan. And take a look at the Democrats who are anti-COVID vaccine compared to the Republicans who are anti-COVID vaccine. Take a look at the older folks, the college graduates, the people with underlying health conditions, urban residents, compared to rural residents, younger people, people without a college degree. So there's become this dichotomy in advocacy where we've ended up with this red-blue kind of difference, which I get it if you're talking about Build Back America plan and you don't want to spend the money, but I don't get it when we're talking about protecting families, protecting vulnerable people, returning our economy to normal. How we ended up with this partisan debate, I don't know. However, there are positives. Take a look at this. A clear majority of Republicans have gotten vaccinated. So it's not some kind of monolithic viewpoint. It's not like Republicans are against vaccine. A majority of them are in favor. Just like a majority of Republicans believe that climate change is real. So it's just the very loud voices of this minority that get amplified by sympathetic politicians and media sources that distort the arguments. Now, take a look at these data from friends of mine at the University of Michigan. They find that individuals who resent authority are twice as likely to never wear a mask, and individuals who believe the truth about coronavirus is being kept from the public are twice as likely to never wear a mask. So how to communicate with folks like this? The NIH has written material, the CDC has written material. If you want to take a quick screenshot with your camera and look this up, feel free, but you can just do, COVID vaccination communication and then CDC or NIH, and you can get it pretty fast. Now, what I'm doing with folks who don't want to be vaccinated, I'm trying to validate and respect their concerns. This is an old trick that clinicians have. I've been trying to convince parents as a pediatrician to vaccinate their kids for decades. And you affirm and agree as far as you can to validate and respect their concerns. You're right that the pharmaceutical industries make a lot of money. You're right that the vaccine was developed in record time. You're right the government has historically treated one group or another group, depending upon what the concern of the parent meant, African Americans, Native Americans, whatever, badly. You've thought about this a lot. You value your freedom. There's no harm in validating that. And I'm giving you some holiday advice here at the dinner table. But you may want to transition them to protecting themselves, helping others, protecting the family or the clan. So if they don't want to get a vaccine, see if you can coax them to consider the benefits for their family. Maybe they'll get it for the sake of their loved ones or their community. And, some people may be influenced by celebrity spokespersons. I'm impressed by Dolly Parton and Morgan Freeman. You can look them up on YouTube. Absolutely remarkable public service announcements. With Morgan Freeman, he speaks for about a minute and a half. And Dolly Parton shows herself getting her own vaccine, and then she sings a song. So amazing stuff. And counter-arguing is often counterproductive. You need to take a low-key stance. People have heard that these are safe, effective vaccines over and over and over, and they just don't believe it. So it may be more than information that's going to convert people's views. Now, let's end on statements for the arts, vaccine mandates. If you want to open your arts venues or your museums for vaccinated persons, you can do what Broadway's doing, which is you have to show your vaccine card. You could try to keep things more democratic, small d, by also offering non-vaccinated people the option to show that they have tested negative within the last 2 days. And I certainly think you should consider universal vaccines for staff, docents, volunteers, and performers. Because I do not want to go to your theater if you can't tell me that you haven't gone to the trouble of having your performers and staff members vaccinated to protect me. It's like a healthcare worker. I don't want to go to your hospital if your healthcare workers are not vaccinated and are going to risk infecting me. And I feel like the arts are a little bit like the healthcare industry. You don't want to infect your patrons. And physical spacing is a good idea when you can manage it. Surface cleansing, concessions, keeping those the way you did before. Online ticket sales are good. Pre-ordered concessions are a trick that many of you are using. Outdoor activities, optimizing indoor air quality, communication of safety measures to the audience. Tell them what you're doing. Announcements from the stage, on your website, notes in the program, having respected community spokespersons make some statement. So try to rebuild confidence in our patrons. And these are Crystal Pollitt's guidance for your building engineer. It's on our website here. And we've published it in a book chapter and in a journal article. And this is Crystal's low-cost air purifier, 60, 70 bucks. You can do as well as 400. And these are all on the website. You just type YSPH, COVID, school, and you'll get it in a heartbeat. And we're doing a lot with the Governor's Task Force, Facebook, the National Academies of Science, Engineering, Medicine, the World Health Organization. We've worked with the Creative Coalition, the University of Southern California, Rotary International, most importantly, the Shoreline Arts Alliance, and with the Global Health Leadership Initiative. We've been working with all these groups on all these issues for the last almost 2 years now. So I wanted to conclude by saying vaccinate, 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 test, test, test. These are powerful tools to get us out of this pandemic. We need to rebuild consumer confidence by protecting our performers, staff, and patrons. If you need any questions answered, there's my email. And I want to thank the Shoreline Arts Alliance, my YSPH colleague, Professor Crystal Pollitt, the hardworking Charter Task Force members who are on the call today in the Reopening Connecticut Arts Venue Science-Based Safety Initiative. And these are they, and these are two of the resources that I find very helpful that Eric has up on his website. So take a picture of those and visit them anytime you like. So that's it for the formal remarks. Usually these are an hour of back and forth, but Eric thought that this formal reminder might be helpful to you. So let's get out of the shared slides.
Well, thank you, Sten. Yeah, this is. Thank you so much for just encapsulating all of that for us and helping us think through so much of this. We have Crystal with us also today. So now's your opportunity, folks. Just start flooding the Q&A with questions. I'm gonna. We actually have several that have actually come in through email as well. So I'm gonna start launching it, but do folks go ahead and send questions through the Q&A. I think a good one to follow up with is actually the first question that was put in the Q&A today from Alden Murphy of Musical Masterworks. They require vax and masks and social distancing now, and they want to know, should they require booster of all audience members and performers in 2022?
It's hard to require it because let's say that they got their second dose just 3 months ago, then they're not eligible for it. Do you really want to throw all those people out? I think that the core vaccination is good enough to keep people out of the hospital and keep people from dying. The booster is likely to be more helpful to reduce symptomatic infection. So it's like an extra bonus. And we want to encourage boosting as much as we can. And I do think that you'd want to encourage boosting or mandate it for your staff and your performers. To demand it in patrons might be a step too far. And I think what you'd like to do is encourage it as much as you can.
Great, thank you, Sten. This may be over to you, Crystal, but I'll offer it to both of you. Many of the performing arts studios, especially in New York City, are going back to using disinfectant sprayers in between users and staggering class times to keep the hallways thinned out. Some claim to be using an alcohol-based spray. Is that effective? Should we be doing it?
Crystal, you get that one.
So for the disinfectants that are being used, referring to the EPA's list of disinfectants was recommended, and I'll put the link into the chat there for recommended use. But cleaning before using the disinfectant is always advisable. And also thinking about the air quality. So having those air cleaners in there, enhanced airflow with the building HVAC is just as important as having that surface cleaning being done regularly.
Great. And this was targeted from for the performance area. So I don't know if this is singing or trombone playing or what we're doing, but all that stands true, I guess. Is that right? Yeah.
Yes.
Okay, great. Darren, I think you have a question about filters you wanted to ask.
Yeah, and I'd like to follow up just to double check that the MERV 13 rating, is that still considered as effective for the new variants? And if you also could go over, if we have one of those DIY air filters, how often should we be changing those filters? I know you've said it before, but I think it bears repeating.
Yeah, that's a great question. So with the variant, we're not seeing any change in the size of aerosols. We're still, as we speak, cough, we're still releasing the same size of aerosol from our mouths, nose. So those filters, the MERV 13 is still completely applicable, useful for Omicron. And I encourage use. So that's wonderful that these DIY devices are being constructed and used. With regards to having them changed, we're not overly loading the surface of our filters with these aerosols. So changing them every 6 months to a year is completely acceptable. If we were in an area with very high levels of air pollution, if they're placed outside or if there are wildfires, then we would start thinking about placing them more regularly. But indoor use where there's no other sources of particles, 6 months to a year is just fine.
Great, thank you. John Carl, you have a question?
Yeah, hi everybody. Thank you. I ask a very basic question. How long is this waxing and waning of the virus going to go on in your guess, in your estimation?
We have a coronavirus that has become very well adapted to humans instead of its natural host, the bat. And it's with us to stay, short of wildly successful global level vaccination. It will be joining the family. It has joined the family of respiratory viruses that circulate every year, especially in respiratory virus season from December to March, and sometimes at lower levels elsewhere in the year. It includes the para-influenza viruses, the influenza viruses, the rhinoviruses, the respiratory syncytia viruses, echoviruses, enteroviruses, and a bunch of others. And so, and other coronaviruses that are more benign that have been circulating for decades. So this one is now with us to stay. Now, let me just tell you, I do not live in mortal fear of the coronavirus because I am boosted. So to me, coronavirus in my life is very similar to all these other family of viruses. It's become a nuisance. And if I get sick and I have to go to bed, that's a shame. I'll miss work. I might infect my wife, somebody at work. So it's a nuisance, and I don't like it, but it's more like flu. However, it's more lethal in the elderly. So I've got greater concerns that I might be an inadvertent transmitter to the elderly. And I'm also concerned that I might transmit to the unvaccinated, be they adults or children. So I'm being a little more cautious than, say, with all those other respiratory viruses. But we want everybody to get the flu vaccine. We want everybody to get the coronavirus vaccine. We've always wanted everybody to get the flu vaccine because in a bad year, 50,000 people are killed by flu in America. And in a good year, it's 10,000 people. So, there's nothing particularly different about coronavirus. It's just new. And the fabulous news is we've got this great vaccine. So I'm thinking we need, because we've got this tool, we need to try to get society back to normal. A big contribution would be made by people who are currently unvaccinated if they would get vaccinated. And as a public health professional, I'm a little bit on the militant side. I feel about vaccines the same way that I feel about red lights and speed limits and stop signs. I don't want you to speed. I don't want you to run a red light. I don't want you to run a stop sign, because your freedom risks my health. So I feel the same way about a vaccine that is the source of a global pandemic, has killed more than 800,000 Americans, has infected more than 51 million Americans, that's killed 5 million people around the world. I think everybody should get vaccinated.
Thank you, Sten. Thank you. I'm moving over to the Q&A here from Kathleen at the Barnum Museum. Hartford Business Journal reported yesterday that a consortium of Yale MDs have petitioned Governor Lamont that Connecticut legislators are not taking this serious enough, and mask mandates for indoors should be reinstated before hospitals get overrun again. Thoughts?
That's what we do at Yale. We have never stopped our mask mandate, and all of us in our classrooms, including the professors, are masked, and people who are in their private offices can unmask, or if they're in carols and they're a certain distance away, they can unmask. But otherwise, we're a universally masked community. And I sit on the public health committee that advises the provost's policy committee, and that's what we've recommended. So I see no harm in masking. You're going to take a little more risk at the restaurant because you can't eat and mask at the same time. So that is a riskier environment, but people can go to restaurants and be checked as they do in New York City. I mean, I was in New York City on Sunday, and I was checked for vaccination status at the restaurant. I was checked for vaccination status at the theater. I went to Lehman Trilogy. What a great show. And at the end of the day, I thought that was very reasonable. I just saw the mayor of New York City trying to keep us all safe.
Excellent. Thank you. Judy Dwarin, you have a question?
Yeah, I'm just voicing a question that's come on the chat twice, and that was concerns about the J&J vaccine and booster, in the latest news that it's that much less effective than the others, and any comments that you would have, Stan, about that.
J&J, which is a live vector vaccine, it's not an mRNA vaccine, did a great job protecting against the ancestral variant, the alpha variant, and also did a pretty good job with Delta. It turns out that the immunity wanes a bit faster, and so J&J recipients have been protected well, but they should now get boosted with the mRNA.
Excellent. And John Carl, you have your hand up as well.
Yeah, you mentioned how we can be protected, or we can protect ourselves down to just being asymptomatic or having minor symptoms. And I know there's been concern about people who become very sick and what COVID will do to them over time, or may do to them over time. Do we have a sense about whether or not people with lesser symptoms or no symptoms can be affected down the road by COVID if they're infected?
We have a lot to learn about all of this. It hasn't been around long enough for us to have much in the way of long-term knowledge. We think that the vaccinated are less infectious. We know for a fact that the vaccinated are less likely to get serious illness. we think that the less vaccinated are much less likely to get long COVID with long-term consequences. And that's where we are now. A series of things we know for a fact and a series of things that we suspect are true. But, you know, for my money, I mean, I've been studying this stuff for 40 years. And coronavirus is just a variation on a theme. It's just a different respiratory virus. And it's, you know, it's a different virus from measles or influenza or a bunch of others. But a lot of the principles translate. And typically, the higher your viral load, the more infectious you are to others. The higher your viral load, the more likely you are to have serious disease. The higher your virus load, the more likely you are to have long-term consequences. And vaccines prepare the immune system for the invader. And when the invader comes, you mount a very rapid immune response and you knock down the virus load. So we know for a fact that you're less likely to get seriously ill. And I think it's a pretty good guess that you're less likely to have long COVID and that you're less infectious.
Two quick questions, and then Darren, I'll get you. We have a question from Facebook. The supply of booster shots is a current issue. Do you see that that's going to improve soon?
There are lots of booster shots. I think that there is not a supply difficulty to my knowledge. Am I wrong?
Okay. I don't know. That was just a question. I didn't think there was either.
I don't think there's a shortage. We're vaccinating everybody we can get our hands on, and it's not a vaccine shortage. It was at the beginning of the pandemic. It was back in December a year ago. There was a big vaccine shortage. That's why we were vaccinating the elderly and the frontline workers, you know, like healthcare workers and others, preferentially.
And boosters wouldn't be anything different.
No, we want everybody to get boosted.
No,
everybody.
Right,
anybody who's had the vaccine at least 6 months ago.
This sounds familiar from before, I think. What is the current status of vaccine development for age birth to 4 years ago, to 4 years of age? Is there data in this age group about transmission to family members and others in daycare? Sounds familiar.
The kids seem to have lower viral loads, and there have been many fewer daycare outbreaks than we would have expected, and that may be the reason. Because it's not like kids aren't touching each other and touching the toys, and I mean, there's plenty of sharing of bodily fluids, you know, with the touching of all of that. So I feel like it's probably true that they're a bit less infectious. A kid's nostril is physically so much smaller than my nostril, and my nostril can hold so much more mucus and virus that there's also just the size factor. So we think they're less likely to transmit. But having said that, we'd love to get them vaccinated. And the studies are showing that they don't quite have as robust an immune response as the older kids do. So they're now trying a 3-dose series like we have for a number of other vaccines rather than a 2-dose series. So let's say you want to be vaccinated against hepatitis B vaccine. You're vaccinated 3 different times. And that's because after the 3rd time, there's like a 95% chance that you're going to seroconvert and be protected against hepatitis B. Well, it may be that we have to vaccinate the kiddies instead of 2 doses like we do adults. We may have to vaccinate them 3 times. That probably won't be clear until March, April of next year.
Well, I think we just got an answer to our, or a little more clarity. Booster appointments are hard to get multiple weeks wait if you're going to CVS and Walgreens. It's probably a staffing shortage rather than a supply chain issue. So that was
well, if you can't get it from CVS or Walgreens, try to get it from Yale New Haven Health System. If you can't get it from that, try to get it from Hartford Health. Sadly, there's so many providers and they don't have a common appointment system. I mean, for my money, we should have established this a year ago, where you go onto one very well capacitated website and you pick the time you want, and it says, okay, to get this, you got to go to CVS and you'll pay $100. Or you can go another time and to this other group and pay $80. I mean, have it consumer friendly, but
Yeah,
that's how they have it in Europe, and that's how they have it in China, but we haven't managed that in Connecticut.
We haven't figured it out. Darren, I see your hand is up. You got another one?
Sure. Real quick, this is sort of going back to what you were talking about before, where this is really a virus within bats initially, and it jumps species. But I've been reading and hearing about concern about the deer population in this country. And I know they've been studying that the COVID has jumped into the deer population. I just didn't know if you could shed more light on that. Is this a concern? Is it, and what we're looking at in regards to that?
There are many mammals that bat viruses can theoretically infect. With the SARS, we found that civet cats in China were infected. With MERS, we found that camels were infected. So at the end of the day, we expect viruses to be able to jump species, depending upon the immune and biological characteristics of those species. So the fact that it's jumped into deer is interesting, but I don't think it's of any public health consequence.
We have a question that came in from Shoreline Corral, Tom Mulvis. I'm going to cut to the chase here. It's a big, long question, but they have, they're currently singing maskless. They have 40 singers, 3 feet apart. They're cordoning off the 6 rows, the front 6 rows. They are really wanting to know, how much rigor do you recommend in demanding to see vax cards, IDs, et cetera, at the door? I think that's the big root of the question.
I don't want, as your patron for your concert, I don't want to sit next to an unvaccinated person who hasn't had a test. I'll sit next to an unvaccinated person who has had a negative test. I'll take my chances there. So the way I look at it is from a consumer confidence, patron-centric point of view. And I certainly don't want to come to your theater if your staff haven't bothered to get vaccinated and could care less about my health. They're perfectly willing to transmit their virus to me. I certainly don't want to come to your theater. So that's the way I look at it. I'm a physician, so it's consumer oriented. I want to meet the needs of my children. I'm a pediatrician, meet the needs of my children and their parents, and I want to try to meet their needs as best I can, and that's how I think. And I think that in the arts, we have the same attitude. We want to fill our theaters with the extraordinary experiences that we are looking to offer. We want to bring our dance studios full of our students. We want to have our museums filled with patrons who take full advantage of what we're offering. And I feel like let's try to keep everybody safe with these reasonable approaches. So I would be militant about ensuring if you don't show me that you've been vaccinated, or you don't show me that you've had a negative test in the last 48 hours, I would politely disinvite you and encourage you to get that test or get the vaccine and come back. It's my view.
I think your answer is the same, but I'm going to read the question. If a staff member tests positive for COVID-19, should all staff fully vaxxed who work in the same shift be required to quarantine until they receive a negative test? Or can they continue to work unless they test positive?
The fully vaxxed folks are at such low risk of untoward events that the only thing they're at risk of is having gotten infected, and then maybe they're infectious to others. So a common CDC has recommended for children that if the kid in this classroom is positive, the others don't necessarily have to get quarantined, as we've been doing for the last year. And that it's a reasonable thing to get tested and to remove the infected person from the environment, obviously. But, and that person goes into a week of isolation until they're test negative. And then we test everybody else. And if somebody else is positive, they also leave, but not to overreact.
I just noticed what time it is. I don't know how it's 11 already.
I have to go. I'm sorry.
I know. So
if there are
here
other
we
questions,
are.
maybe Crystal can hang on, but I've got a hard stop at 11. I apologize.
I'm sure many are in the same boat. Thank you, Sten. Thank you, Crystal. Thank you, our wonderful task force team, and thank you all wonderful artist folks out there who are helping the arts community continue to find our way to a thriving economy and looking for a future. I went to my first orchestra concert this weekend. It was wonderful. I'm so excited to continue to see things like that. So I just wish you all a happy holiday. We'll get together shortly after the holiday, and hopefully we can help find more answers. I see there's a question about how to convince the restaurant owners to encourage masks so that your band can continue to play. We have so many really important questions that we still don't have answers for, but I think that you might want to refer back to Sten's slide on how to help your fellow friends be convinced without condemning them. So good question, Thomas. Thank you. We'll be in touch. If you need anything, don't hesitate to reach out to office@shorelinearts.org or communications@shorelinearts.org, and we'll try to help you. And in the new year, we plan to get out into some more buildings to help folks find their way. So have a great holiday. And again, thank you all for so much. Take care.